Hello everybody, Jeremy Latham, the hip surgeon here. One of my patients the other day asked me about when you can drive again after a hip replacement. Very common question. We all, or most of us, drive and want to get back to doing this as soon as we can after surgery. My advice is wait for about a month or so after your operation. The critical thing about driving is you need to be physically and mentally fit to drive. You need to make rapid decisions quickly, and you need to be able to do an emergency stop. So after about a month or so after your operation, as long as you feel fine, the wound has healed well, and you're independently mobile, meaning you're not using crutches anymore, try getting in and out of the car at home. Make sure you can get in and out quickly and safely. Drive to a quiet spot and do an emergency stop, away from the rush hour, away from major traffic routes. You'll find that you get your skills back very, very quickly. One top tip from me though is in supermarkets, make sure you park at the end of a row so that you can open the car door fully. It's pretty difficult posting yourself into a narrow space, and you may cause a bit of pain in your hip if you try and get in through a narrow crack in the door, so to speak. So make sure you can park at the end of a row. Regarding insurance, there's no need to tell your insurance company. It's not a reportable condition. Hope that's been helpful. Please get in touch if you've got any questions or queries. The details are below. Thanks for watching. I'm Jeremy Latham. I'm the hip surgeon.